your respiratory system is made up of your lungs, airways, which is the trachea, bronchi, and bronchioles, diaphragm, voice box, throat, nose, and mouth. These are just some key root words and suffixes and prefixes. These come out of page 286 in the textbook. And you could see the ends of some of these words here. Centesis means surgical puncture of a cavity to remove fluid. You have ectomy, ostomy. Okay, I actually have all of these written in my CPT book. You could find, a blank page or, somewhere where you could actually write this in your book, because a lot of these endings you'll see in, all different sections of CPT. All right, so once you know these, it will help you, recognize or, to figure out the definition of a term that you might not know. All right, mediastinum and diaphragm. Okay, the mediastinum is the portion of a thoracic cavity between the lungs that contain the heart, aorta, esophagus, trachea, thymus gland, blood vessels, and nerves. And the diaphragm is the primary muscle used in respiration and divides the thoracic, which is the chest cavity, from the abdominal cavity. All right, and this question, or not this question, but this slide, I just wanted to point out, I actually was doing CPC tutoring with someone over probably 3 days ago, and they actually had a question that had to do with what's the difference between the mediastinum and thoracic cavity. It wasn't worded just like that, but I mean, that's basically what the question was. So I just wanted to point out again, you need to know your terminology to understand coding, and then also, for the CPC exam. All right. The next part the book talks about is the hemic and lymphatic systems. Okay, the hemic system pertains to the production of blood, including components essential in providing defense against foreign organisms and substances. And the primary structures are the spleen and the bone marrow. Okay, now as far as ICD-10 coding goes, these are some of the main codes you'll use for respiratory coding. They are mostly the J codes. Okay, J00 to J06 is acute upper respiratory infections. Okay, other diseases of the respiratory tract are J30 to J39. Okay, so just take a second to read over this slide. And there are some Z codes for symptoms and vaping related disorders and COVID codes. All right, I also just want to take a minute to just review some of the ICD-10 coding guidelines. All right, so just to look at an example, let's turn to page 744, which are the asthma codes in the ICD-10 book. All right, so the codes I wanted to look at, J45, it's up the top of page 744, it's the asthma codes. Okay, underneath that in red, you'll see it says use additional code to identify, and then underneath you have some different terms there. Okay, so I just wanted to review that. If you see that throughout the book, use additional code. Okay, that's exactly what it sounds like. Okay, it's saying that you have to put a different, another code with it if it's in your report. So say you were coding, J45.99. Okay, then you would go back and see those directions there, and it says use additional code. Okay, so does the person have exposure to environmental tobacco smoke? If it's yes, then Z77.22 would be the second code that you add with that. All right, so just again, remember to always read the directions in the tabular, because it gives you, it tells you other things you'd have to do for coding. All right. Now, there is also an excludes 1 right underneath that, and it excludes 2. Okay, I'm going to go over what those mean again because it's been a little while since we talked about it. But does anyone remember what an excludes 1 is? Okay, so an exclude 1 is basically telling you that whatever is in the excludes 1 cannot be coded with the other codes in the series if that's what you were coding. All right, so just going back to the same example I was just saying before, make pretend you were coding a report and the code that you got to was J45.99 for other asthma. Say that's what your report says, that's your main code. Okay, after you code it, you would go back and just look at the excludes 1 there. Any of those other codes in the excludes 1, like detergent asthma, which is J69.8, or minor's asthma, code J60. Okay, those 2 codes, well, really those 4 codes, because there's 4 there. Those 4 codes cannot be coded with J4599. So it's basically telling you that, say your report says that the patient had, minor's asthma, okay, you would code J60. Okay, you wouldn't use that J44.99 for other asthma, okay? And you can't code J45.99 with J60. Okay, that's what excludes 1 is. Those codes do not go together, okay? And excludes 2 is different from an excludes 1. Okay, if you look underneath the excludes 1, there's also an excludes note. Okay, it says asthma with chronic obstructive pulmonary disease, J44.89. Then underneath that, chronic asthmatic obstructive bronchitis, J44.89. Okay, an excludes 2 note means that if you are coding one of the other codes in this series, take again the J45.99 example, that can be coded with the excludes code. Okay, so you can code J44.89 with J45.99 if your documentation supports it. Okay, so excludes 1, it says what you can't code together, and excludes 2 gives examples of what can be coded together. Okay, does that make sense? Does anybody have any questions on that?